Welcome to the show. I'm Kawanda Green. Thank you so much for joining us. Two things I know for sure: kids will play, and in sports, you will have injuries. In the US alone, there are approximately 30 million children under the age of 18 who participates in organized sports. And with that 30 million, we have over 3.5 million injuries per year. That's 3.5 million injuries. That's not even including the collegiate or the professional athletes, or even the everyday people who are just active. But we're just talking about the children. Today, we have a doctor who works in the Orthopedic Sports and Spine Center for Emory, and he has been consistently named in the Atlanta Magazine's top doctor in the past, top doctor issue in the past 5 years. Let's welcome Dr. Augustine Kandua to the show.
Thanks, Kawanda. Thanks for having me. Great to be here.
Thank you so much. Thank you so much for being here. How are you today?
Doing well, doing well. Yourself?
I am fantastic. So, Dr. Kandua, can you tell us a little about yourself and why did you choose orthopedics?
Yes, of course. So I am a native of Ghana in West Africa, and family moved out here in the early 80s. I grew up in Madison, Wisconsin, as well as spent a lot of time in California. I did my undergrad at Stanford University and then my medical school training, as well as orthopedic residency training at the David Geffen School of Medicine at UCLA. And then went on to do a 1-year fellowship in both research as well as an additional year in specifically sports medicine, orthopedic surgery training, where I learned the minimally invasive techniques for treating athletes, everyday people, and weekend warriors as well. I have been married for 14 years to my lovely wife, Shantae, and I have 3 children. We have 3 children together.
Wow, that's so awesome. What made you choose orthopedics? What made you go
I
into
think
that field?
orthopedics, great. Yes, actually, I knew I wanted to be a physician from early on. When I say early on, I believe it was in 6th grade where I really had the interest in the sciences and medicine. And that interest really peaked the following year in 7th grade during a show and tell where one of my classmates' fathers, who's actually an orthopedic surgeon, came in to show us a little bit about what he does. He brought in x-rays, he brought in models of bones, as well as various implants that he used, and I was basically sold from there.
What exactly do an orthopedic doctor do?
Yeah, that's a great question. I think the field of orthopedic surgery itself is quite vast. And generally think of orthopedics and you may think of fractures or broken bones, but we do much more than that. We manage both non-surgically and surgically various musculoskeletal conditions. That includes arthritis, which may lead to joint replacement surgery. And it's ultra subspecialized, where we also have subspecialties such as hand surgery, foot and ankle surgery, spine surgery, sports medicine, of course, as well as pediatrics and trauma work.
Okay, you mentioned a couple of things that I want to ask you about. Okay,
Sure.
you mentioned, I think, did you say hip replacement?
Joint
I don't know if
replacement,
you said
yes, and hip replacement would be included.
Okay, so when who's a candidate for hip or knee replacement?
That's a great question. So for the most part, hip and knee replacement surgery is basically sort of the final or most long-term treatment for arthritis. When we talk about arthritis, it's essentially a wearing away of our joints. Imagine your joints being like a tire. Over time, as we drive, we wear down the tire and we develop arthritis. In my practice, we attempt to treat patients, non-surgically first, whether it be injections of medications into the joint, which could include stem cells versus cortisone injections versus some lubricating injections. Of course, we always, recommend a good exercise program to build up the muscles around the joints, as well as various, medications. And when patients fail these treatments, and if they're debilitated enough by their arthritis, meaning their arthritis dictates their lives, as opposed to them dictating their own life, then that's when patients, come to the realization that a joint replacement may help them. So we don't, take out the entire joint. We basically give the joint a new surface. It's analogous, again, if I use a tire analogy, to putting a new tire on the same car such that the car performs better.
You said you can inject the lubricant in there. How long does that last? I've never heard
Great
of that.
question.
How long does that last?
Yeah, the lubricating gels are essentially synthesized components that are similar to some of the components or products that we find in normal joint fluid. And the goal of these medications is to really help with pain. And there are various types of lubricating injections, but they're pretty much all the same. And the goal of which is helping with pain. And they can last upwards of 6 months. I've seen them last longer than 6 months, and I've seen them last less than 6 months. So upwards of 6 months, if you read the information that the companies will provide, that's typically what they mention.
So what happens after 6 months?
Great question. So essentially, if a patient had great results and the pain relief lasted for 6 months and they're interested, we can certainly repeat the injections, maybe once or twice a year or every 6 months. Some patients really find that as their ideal treatment option in order to avoid surgery, still getting the pain relief they have, and do so in a minimally invasive manner. But at some point, these injections may no longer work, or a patient is looking for longer-term relief. Instead of 6 months, they want years of relief, and that's when the joint replacement becomes an option.
So when people get repeated injections, does that have long-term effects on the body?
It can.
Are there side
when we
effects
talk
from
about,
the injection?
yeah, so it's possible. When we talk about injections, the vast majority of injections involve some form of steroid medication. Now, there has been some evidence in the literature to suggest that the steroids may, over time, cause the cartilage in the joint to become a little bit thin. But there is some mixed data when that is looked at in great detail. Another issue is that there's a large component of my population with diabetics. And steroids, when taken into the system, can cause blood sugars to go up. Typically with injections, that increase in their blood sugar may last hours to days, and it's typically not a long-term effect. In these settings, I recommend patients drink plenty of water over the course of 72 hours after the injection to kind of minimize that possibility.
Okay, Dr. Kandua, you mentioned arthritis. Okay, what about when people have arthritis and they have fluid? They feel like they have fluid in their legs or in their knees. How can they relieve themselves of that fluid? Or
yes,
does
that
the
fluid
affect the arthritis or make it worse or better? Or
I think part of the response, arthritis is essentially an inflammation that occurs in the joint. And when a joint becomes inflamed, one side effect or one product of that is the cells that line the joint, they produce a fluid in order to pad the joint. And that's manifested as a swollen joint. More often than not, that swelling can be reabsorbed by the body over time. But things that we can do to help that along are icing the joint, providing some gentle compression that's not too tight. And if the swelling begins to cause significant pain and it's taken some time for the swelling to go down, then that's when it's time to see an orthopedic surgeon to discuss having the fluid drained from the knee through a simple injection that involves a needle and some syringes.
How do we know when we're listening to someone who's an idiot juxtaposed to someone who has actually done the stuff they're teaching?
You definitely have a lot of people out there who are talking and talking and talking. So you can double check their work. If you're seeing that they are saying like the sky is blue, but all these other things are saying the sky is red, all right, you might need to start to follow somebody else most likely. So you can Google what is a stock, what is a REIT, what are some good stocks to invest in, what's an index fund, so on and so on. I always think that's the best place to start.
Hey world, I have a quick message. It's about safe driving. All right, let's go. Anytime you're driving, have the seatbelt buckled tight. Both hands on the wheel and your phone out of sight. When not in your hand trying to text somebody back. Because if you do, your car might get smacked. The moral of the story, just put your phone down. The people on the road will stay safe and sound. Put your phone down, put your phone down. People on the road will stay safe and sound. Yeah.
I work in the #1 cable news network in the #1 market in the nation, and I'm the only full-time African American woman in my newsroom. Being inspired is really saying that at the end of the day, no matter what's happening in my world or around me, it's bigger than me.
Do people have to have a referral to come to you, or can they just call up an orthopedic doctor and just go for a visit?
Actually, both are possible, and unfortunately, some of that is dictated by the insurance that one may have. Unfortunately, again, insurance has, come into play when it comes to making healthcare decisions in terms of what physicians think are best. But for the most part, patients are able to call us directly and come in to see us without a referral from their primary care physician.
Okay, so although death from sports injury is rare, softball and baseball is at the top, with 3 to 4 kids dying every year. And I read that brain injury is the leading cause of death. Why do you think that baseball and softball is the top of the list when it comes to death and sports injuries?
And the most likely explanation for this is, with baseball and softball, you're dealing with high velocity, high speed projectiles, basically the softball and the baseball. And when you mix that with a direct blow to the head, it can cause some serious injuries that could include anything from, a headache to a concussion to actual bleeding in the brain, which can lead to more serious consequences.
Okay, I read that you work out a lot. Did you play any sports when you were in college or high school?
That's an interesting story. I did play sports growing up and upward until sophomore year in high school, when my parents, who are traditional West African parents, said, "Hey, put the ball down and pick up the books." Although I always had a book in the other hand. So that was sort of the end of my sporting career, but I still continue to maintain a level of activity, whether it be weekend warrior-like sports, working out, which included either weight training or cardiovascular activity. I think that's definitely important, especially in our population, to minimize, the side effects or long-term effects from the chronic illnesses that tend to plague our community.
Yeah, a lot of people, we could say that the pandemic last year has kept a lot of people in the house, but a lot of people have kind of shied away from going outside and doing exercise and working out.
Mhm.
But don't that help your joints and, your bones when you at least do walking or some sort of activity?
Yes, certainly. I oftentimes, encounter patients that tell me that sometimes as they move their joint, they hurt less. But when they've been sitting for a while and then they go to stand or sit, they start to hurt, particularly in the knee. So I think exercise and moving around is certainly important. For the joints, number one, it helps build the muscles around the joint, which can help support the joint and decrease pain or decrease the likelihood of injury to that joint. Secondly, our bones are actually, living, breathing organs. And similar to muscle, if you do not use it, you lose it. So the bones actually like to see force. If you were to look at an x-ray of someone that had been doing nothing but maybe sitting for a period of 1 month versus a similar individual who was more active, you would certainly see a difference in their bone structure. They would have stronger bone, which would appear as more white on an x-ray.
Wow. I heard that vitamin D can affect a lot of things. Is there any significance to, vitamin D and our bones? Does it affect our bones?
Yes, definitely. Vitamin D is intimately related and directly related to how we metabolize various elements and how we metabolize to form bone and to build bone. Directly related to that, as folks may or may not know, vitamin D, the primary source of vitamin D is actually the sun, as far as synthesizing or making vitamin D through a reaction that occurs at your skin. So as opposed to taking supplements, I think the best thing you can do to help with your vitamin D metabolism is to go outside.
So they can knock out two birds with one stone. They can go get some activity
go.
and get some vitamin D at the same time. At the same time.
Exactly. Yes, ma'am.
Dr. Kandua, the sports have become so competitive. Kids are starting like strenuous training at younger and younger ages. Have you noticed that the injuries have been that, you've seen more injuries with the kids?
Oh, yes, without a doubt. We've certainly seen injuries that you would typically see in a high-level athlete in much younger populations. I mean, things such as ACL injuries in 8 and 9-year-olds. I think the issues are the societal pressures, as well as the pressure to compete, advance, and win has been sort of trickled down to the younger and younger population, where you're having kids that start to ultra specialize. When I was growing up, I played everything, and I played sports throughout the year, different sports, whether it be soccer, football, basketball, and with different sports, use different muscles. Now what we're seeing is, our kids that are playing a single sport, and they're playing that single sport year round. Take baseball for an example. There's travel teams where you can drive to Florida in the winter and still play baseball. So these kids are playing the same sport, using the same muscles, loading the same types of joints over and over and over. And that basically leads to overuse injuries, which we're seeing manifest as fractures, tendon tears, and significant injuries in our younger population.
Wow. So would you have any warnings or some suggestions or advice for parents of these kids, putting all this pressure, on the kids and them just doing one sport?
Yes, of course. I think it certainly starts with the parents, and having them, building that rapport with parents and building that understanding. That I think it first starts, with the parents speaking to the child, or even a physician, with the child present, in terms of, number one, encouraging the child to let them know if they're playing hurt, or if they have injuries, or if they have pain. Because it's not a matter of, no pain, no gain. It's not a matter of necessarily pushing through it. I mean, there's a difference between playing, where you're hurt versus injured. And I'd say the latter is more significant. So that's number one. And then with that explanation and really understanding that a single sport using the same muscle groups over and over and over can lead to injury, that may sort of decrease the need of that parent or want to have them play that same sport year round. They can still be active. They can play another sport, during another season. Like, for example, you play basketball in the winter instead of playing baseball throughout. So I think that'll certainly help, reduce the risk. But, there's a lot of external pressures that are out of your control. Some parents, these athletes that have trainers and that are playing the same sport throughout the year, they think their son or daughter is going to be the next great. So they're willing to invest a lot. And it's hard to, to discuss the other approach to minimize injury to that child. And I think, in addition to the physical ailments or injuries, it's possible to have, psychological trauma in these children who have such high expectations placed on them at such a young age.
Could there be some long-term damage, with the kids starting so young and going so hard, so young for so long?
Yes, there is, and there can be. And when we say long term, I mean, we're seeing these issues even within their childhood. For example, let's take if someone tears their ACL, which is a primary ligament in the knee that helps support the knee, imagine the ACL as the brakes for a car. So if someone tears their ACL, 9 out of 10 times they were doing something that was quite active, so they need that ACL to be reconstructed. So studies have shown us that patients that have had a torn ACL and had it reconstructed, they have higher rates of early onset arthritis. Now, I have x-rays of patients at age 16 and 17 who already have arthritis, which we typically don't see until 50, 60, 70, and 80-year-olds. So there are long-term effects of overtraining at an early age, which predisposes these children to these injuries, which oftentimes may need surgery. And the result of having that injury can lead to the joint just not functioning normal. You know, as surgeons, we like to think that we're great, but we can never, give you back what God made. So we're seeing some of these effects as a result of repetitive overuse injuries or doing a lot at a young age. So we've got to kind of walk that line as far as staying active and participating in sports and being safe at the same time.
It's a topic that's kind of taboo. We talk about it in and out, but we really never just come out and say, let's just go on and talk about this fertility thing.
And the thing about it is a lot of people just assume that everybody can easily conceive, and that is just not the case.
Having a community of Black women that are going through the same thing that I am has made it easier for me to talk about it and has been a tremendous amount of support.
So if you get a 16, 17, 18-year-old who's developing arthritis, what can they do? Is there anything that they can do to kind of repair that and be able to get back on the court or the field and perform at a high level?
Yeah, another great question. You know, with arthritis, I would call arthritis a diagnosis that we see on an x-ray. I say that because we have instances where patients have arthritis on the x-ray, but they say, "Doc, I'm fine, I don't have any pain." Versus the other side where patients are writhing in pain, they're debilitated by the arthritis. If a 16-year-old develops arthritis, there's nothing that we have, in our toolbox per se, or with the research that we have to reverse that process. Again, I go to the analogy of the car because it's something that people can easily grasp. Imagine a tire that's worn out, and that's the arthritis. You can't really put a new tread on that tire. Instead, you have to drive the car differently until it comes time for a new tire. So in these very young patients, that it really poses a difficult situation for us as practitioners, for the child themselves, as well as their parents, in terms of how are they going to deal with the rest of their life with this arthritis pain, secondary to maybe something that could potentially have been prevented.
You mentioned stress fractures earlier, and both of my children had stress fractures. Actually, both of them have rods in their legs.
Oh, wow.
Yeah, my daughter has a rod in, I don't know, one of her legs, and she got screws in the other foot. And when she was at Florida State, the doctor said that he's seen so many kids, athletes come in with stress fractures. And my son actually has rods in both of his legs because he had stress fractures in both of his legs that wouldn't heal. So do you think that people who get, rods or screws, could they, perform at a high level again? Is there some training that they can do, or is it just, well, sorry, it's over?
No, that's a great question. So to take a step back, so a stress fracture, as you know, is essentially basically an area that starts to break at a specific bone because it's under significant stress. Now, traditionally, even when I was training, we typically would only see stress fractures in ultra marathoners or in runners who ran to a significant degree. And the classic story is that of a military recruit that does a lot of marching, developing these stress fractures. So I think the reasons why we're seeing them in kids, again, is that overtraining, that pressure to play every day, on weekends, et cetera, which increases, the load on their joints. And, many kids' bodies are just not designed, to withstand the pressures that they're seeing as far as physically. Now, another issue may directly be related to nutrition. We know that the nutritional status of many of our kids has changed, and it may not be what it should be as far as the balanced diet with, fruits and vegetables, lean proteins, et cetera. Everything's sort of grab and go, high sugar, low nutritional content. So I think, diet and nutrition play a critical role as well. And as well as getting outside, that goes back to, getting sunlight to increase the vitamin D metabolism to help as far as stronger bones. But yes, we've certainly, with all these factors, have seen an increase in the amount of stress fractures that we're seeing in children.
Wow, you mentioned going outside. That's interesting because you see kids today, they're in the house. When we were growing up, we were outside all the time. They're on their phones or on playing the game or watching TV in the house. They're not getting that vitamin D. So what can they do to strengthen their bones? Well, you said naturally vitamin D or some supplements, but is there, some foods that they can eat? You said they also need a balanced diet. What are some foods that you'd recommend?
Well, I think in general, a healthy dose of fruits and vegetables. And again, lean proteins, and also, calcium, and an easy source is obviously milk, cheese, et cetera. But I think, more than that, I think sort of relying on maybe a supplement or food to help with overall, physical fitness. I think we need to lean as much on activity as we do on diet. So, if you're stuck inside, instead of playing the video game, we can put on something that has, some motion to it. And there are actually some video games that encourage motion and movement that you can really get a good workout at. So that could be something or a technique to merge the two where they're playing, but yet getting a physically demanding workout as well.
You mentioned the milk, and growing up, we've always heard milk does the body good, milk makes your bones strong. But, I'm sure milk is doing all of that because of what they put in the milk. And then you think about the milk is putting the mucus in the body. So maybe we can think of something other than the milk to strengthen the bones. I'm not sure people like milk, but
Yeah, there are fruits and vegetables that are higher in calcium content. The names of which escape me currently, but certainly milk, we don't necessarily need to rely on milk as a significant or main source of calcium. But I think, again, what's more important is the activity, combined, with a balanced diet, and also getting outside and getting plenty of exposure to the sun, because that's just not happening as often as it did, as you mentioned.
Okay, so we're gonna kind of wrap this up. What do you think, or what can you suggest for the athletes? What can they do to kind of prevent some of these injuries? I know they're going to play and they want to be the best and they want to be on the great teams. So they got to put into work and they're going to have to do it. So what are some things that they can do to kind of protect themselves?
Sure. I think there are several things. I think, going back to number one, listening to your body and being honest with the symptoms that you're having. Because, pain that's consistent or persistent while you're working out or having, or participating in a physical activity or sport is important. And that's the signal to you from your body that you're probably doing too much. And then secondly, as I mentioned, cross training. You could still be an elite football player, but you don't have to play football year round. You can play other sports, you can weight train, you can run, you can get in the water, you can play basketball, etc. And then also, it's important to, it seems pretty elementary, but you'd be surprised at how many people do not stretch or warm up prior to exercising. And there's different types of stretching and warming up. There's the more static where you're actually stretching the muscles and the tendons. And then there's more dynamic things like doing jumping jacks or high knees or jogging in place to get the heart rate up and get the blood flowing before you participate in these activities. So it's about, listening to your body, being prepared, really doing what's right for you, and having, it's almost like investments. You want to diversify as far as the activities that you do.
I am so glad you mentioned stretching, because older people, we don't want to stretch. We just want to go out there and, go walk or exercise or play or whatever. And we don't stretch, and we should. And we're probably the main ones who should.
Agreed. I think stretching is valuable, especially as we mature and our joints and tendons become less flexible. They're at higher risk for injury. So I think it's certainly important.
Okay, and one more thing. What is something that people can do to reduce the recovery time when they tear an ACL or injure their ACL? Because isn't that a long process, recovery time?
It is. As I mentioned, ACL is a ligament in the knee that helps with stability of the knee. And when we do the surgery, more often than not, we actually reconstruct the ACL, meaning we replace it with another ligament. And that's as close as we can come at this particular time. In rare cases, we can actually repair the ACL and put it back where it belongs, but that's more rare as far as the type of surgery. So the healing process isn't just about how the knee feels, but there's also biology involved. And it takes time for the new ACL to incorporate and become part of your body, almost as one. And that process takes months. We're talking 6, 9, 12 months. And that's one reason why the recovery for ACL is so long. The patient may feel well, but their body isn't ready as far as challenging the knee, getting back in those sport-specific activities in order to minimize the risk of re-rupture. So that's part of the reason why it takes so long. It's the biology of the healing that takes this time.
Ooh, I'm glad you said you may feel well, but your body isn't ready. And I'm sure there are a lot of athletes, especially the ones who really want to win, and they're on this top team and they want to get out there. But if they're not ready, they need to sit it out, because it could be a long-term effect on their body, right?
Exactly. They can predispose themselves to re-rupture, and then they're having yet another setback that puts them out another season. So I think it can be difficult for folks to grasp because they say, hey, doc, my body feels so well, I'm ready to go. But you almost have to protect people from themselves in those particular cases. So I think with having, parental involvement, spousal involvement, family involvement, expertise from a healthcare provider, that can help minimize, the unnecessary, re-injuries after surgery.
Okay, Dr. Kandua, are there any encouraging words you want to leave with our viewers today?
Yes, of course. It's been a pleasure being on with you today. I really appreciate the time. I think, especially in our community, physical fitness and activity is of the utmost importance. And you don't have to, really make a big deal out of it, such as stretching. You don't have to get in a pair of sweats and put a floor mat on the floor and start stretching. You can do things at your desk. I think setting specific and smaller goals to allow them to be achievable will allow folks to really, meet their goals, whether it be weight loss or a particular form of activity. So start small and aim big.
I love it. Thank you so much for being here. I really enjoyed this conversation. You've given us so much great information. And thank you for joining us. Thank you. And thank you for joining us. Remember, be careful, stay active, and always remember, if you have health, you have hope. And if you have hope, you have everything. Don't lose hope. We'll see you next time.
the trenches to understanding of dancing with darkness, to realizing that I had to be broken to be a light. Outside of the titles, outside of the responsibilities, what I owe God is everything. And so I speak from a solid foundation of knowing that I'm not my past circumstances, I'm not my past situations, I'm not my trauma, but I am who He's called me to be.
Thank you.